Health Minister Joe Phaahla is visiting Kalafong Hospital. In fact, he's speaking to the media on that update. Let's quickly listen in.
Camping here. Now, we came here to come and get a briefing, hear what has been happening, how they've been managing it, and what impact has it been having on the operations in the hospital. So, first point which I want to state is to thank the CEO, Dr. Machila is here. This is the CEO of the hospital. And the team, we had the team from the management, the matrons and others, also from the province. We've got Mr. Malotani here and other colleagues from the Gauteng province. The MEC was not able to come because of legislature commitments. I want to thank them for, despite all the disturbance, for making sure that the hospital is fully operational. We went to visit a number of areas. There's clearly discomfort and anxiety amongst the staff members because of the disturbance which is happening. But they are very focused. They are very focused. The services are continuing and they are doing all their best in terms of maintaining the services. Now, in terms of our view about this protest is that it is really unwarranted. It's really unwarranted in the sense that our constitution is very clear in terms of the right of South Africans and anybody in the country to be assisted when they need health care. It's very clear in the Constitution, Section 27 makes it very clear that the state must do everything possible to make sure that people who live in South Africa have access to health services, and even more explicit in terms of emergency health services, that everyone must be provided with emergency health services. So now we are cognizant of the fact that the matters which the group which has been demonstrating and coming here to say they want to help the hospital to relieve the pressure of illegal immigrants. We are aware of the fact that because of a number of factors, there are a number of our neighbors who come to facilities like here to seek help for various medical conditions. And I'm sure many of you would have seen anecdotal reports, even from my predecessors in this portfolio, about the demand for health services from various citizens of other countries, especially, of course, the immediate neighbors, but just here at Kalafong, just without any formal written report, they were indicating that it's not just from the neighbors. It's, of course, the neighbors are nearby, so because we live with them, many of them, when they can't find services in their countries, they do come here. But they were also indicating that even citizens of other countries, as far off as India, they do admit them here. And that says that notwithstanding the challenges which our health facilities have, but they are still able to provide a quality health service. We can do better. We should do better. But for the fact that citizens of other countries do leave their countries and come to because this is not the only facility. If you go to Steve Biko, you'll find the same thing. You go to Charlotte Macquarie, you'll find the same thing. And just in Gauteng alone, as we said. So, but we are saying that our constitution is very clear in terms of the right. I mean, the mandate of the state to provide health services for people who are in our country. We do accept the fact that our services are under pressure, and that if this demand for services from across our neighbors keeps on increasing, it will reach a stage where it is not sustainable. But we believe that it is not up to ordinary citizens of the country to think that they can deal with that to help the state. No, that is not the correct approach. There are many other challenges which we must deal with to improve the quality of service. We acknowledge that even without even the pressure of other neighbors, ourselves we do have challenges. in terms of the allocation of funds. There's been reduction. We are not able to provide enough staff. They were telling me here in the various wards about the staff shortages, which is a matter which also with the DG, National DG here, who I've tasked to look at, even before we came here, to look at the issue of staff, because we are discussing with our colleagues in the National Treasury to look at further improvement in the staffing. We know that in many of our facilities, but I'm quite certain that, having, it's not my first time here, that the issue of poor management, I don't think is an issue at this hospital. I must credit the CEO and the team here. From the reports and even the staff morale, you can see that the hospital is properly managed. But in some of our facilities, there is also poor management. And in some areas, there's even maladministration. I'm sure I don't need to tell you. There are reports which we have been reading about some of our facilities here in Gauteng and also in other provinces, where there is poor maladministration of the few resources at our disposal. In some cases, there are also cases of corruption which are being investigated. The President has already signed a proclamation for the SIU to investigate a number of health facilities. So we admit that there are those kind of challenges. So this issue of the additional pressure of high demand, including not only South Africans, but also our neighbors, it also adds on that. But we are saying, we're appealing to everybody to say, this is a matter which we are alive to. It has been discussed in a number of forums. I've even asked the DG to coordinate it with the heads of departments of all provinces so that we look at the magnitude and get advice properly as to how this can be dealt with. I can mention here that, as you will see from our statement, that from our governing party, the ANC, at our committees, there's also been suggestions, acknowledgement that the issue of pressure of additional need for services from neighbors does add additional pressure, and that we must find ways of how we can deal with it, including possibilities of contribution for some of these services by the governments of the neighboring countries, where they themselves acknowledge that certain services are not available. How do we make it orderly so that people don't...
All right, we have to quickly take you out of that briefing by the Health Minister, Dr. Joe Phaahla, giving an update after those protests outside the Kalafong Hospital. Let's quickly